Senior health after 60 requires smarter choices, not more tests. Some routine health checkups for seniors over 60 can increase risk, trigger unnecessary procedures, and reduce independence. You won't hear it during a rushed clinic visit or a 5-minute appointment, but certain checkups are pushed out of habit, not necessity, especially after 60. What if I told you that some of these common tests can lead to unnecessary surgery, lifelong medication, loss of mobility, or even dangerous complications like stroke or infection, all without extending your life? Major medical journals like JAMA, the New England Journal of Medicine, and large reviews from the U.S. Preventive Services Task Force have repeatedly shown that overtesting in older adults increases harm without improving outcomes. In fact, studies estimate that up to 30% of medical tests in seniors provide no benefit, and many lead to a cascade of further procedures. And stay with me until the end, because the number one checkup on this list is still routinely recommended to seniors, even though research shows it can trigger a chain reaction ending in surgery, disability, or permanent dependence. In this video, I'll walk you through 5 common checkups that seem safe after 60, but can actually harm you, explain why the science has changed, and show you smarter, safer alternatives so you can protect your health without unnecessary risk. Before we begin, tell me in the comments, how old are you? Where are you watching from? Have you ever felt unsure about a test your doctor recommended? Your experience helps other seniors feel less alone. Now let's begin. These are 5 checkups that seem harmless, routine even, but carry hidden risks as we age. A full-body CT scan sounds reassuring. It promises to catch everything early and gives many seniors peace of mind. But after 60, these scans often do more harm than good, exposing you to high levels of radiation and uncovering incidental findings that aren't dangerous, but lead to panic and invasive follow-ups. According to JAMA Internal Medicine, repeated CT scans significantly increase cumulative radiation exposure, raising long-term cancer risk. Even more concerning, over 40% of scans detect harmless abnormalities, which then trigger biopsies or surgeries that were never needed. Robert, age 67, was active, walking daily, and enjoying retirement. After a just-to-be-safe CT scan, doctors found a tiny lung nodule. It turned out to be benign, but only after a biopsy that caused complications, weeks of pain, and lingering anxiety. Robert later said, "I felt worse after the test than before I ever worried." Instead of full body scans, most seniors do better with a listen-to-your-body approach. If something truly changes, like ongoing pain, sudden weight loss, or trouble breathing, that is when testing makes sense. Regular checkups with your main doctor, basic blood tests, and simple exams often give enough information. You don't need pictures of your whole body to stay healthy. Writing down symptoms or changes can help you notice problems early. For many seniors, walking, eating well, sleeping enough, and staying calm protect health far better than extra scans. And while that risk is serious, the next checkup is even more common and affects millions of seniors every year. The PSA blood test has long been marketed as a lifesaver for men. Many seniors believe skipping it is dangerous. But after 70, or even earlier for some men, routine PSA screening often detects slow-growing cancers that would never cause harm, leading to aggressive treatments that reduce quality of life. Large studies in the New England Journal of Medicine show that PSA screening in older men does not significantly reduce mortality, but dramatically increases rates of incontinence, impotence, and surgical complications. George, 72, felt perfectly healthy. A routine PSA test led to surgery. The cancer was slow-growing, but the side effects were permanent. "I beat cancer," he said, "but I lost parts of my life I didn't expect to lose." After 70, Prostate care should be about comfort and daily life, not just test numbers. Many doctors now suggest watching how you feel instead of rushing into more tests. If there are no strong symptoms, it is often safer to wait and check again later. This avoids treatments that can cause long-term problems with bladder control or intimacy. Staying active, eating simple, healthy foods, and keeping inflammation low may support prostate health naturally. The goal is not more treatment. It is protecting independence and peace of mind. But women over 60 face a similar issue, one that often goes unquestioned. If this information is helping you see your health in a clearer, more confident way, please take a moment to like this video. It tells YouTube to share this with other seniors who may be facing the same decisions, and it helps them avoid tests that could quietly cause harm. Mammograms are seen as essential for women at any age. Early detection saves lives is a powerful message. However, after a certain age, mammograms often detect non-aggressive cancers that would never spread, leading to chemotherapy, radiation, and surgery that weaken the body. Reviews in the British Medical Journal show that overdiagnosis increases sharply in older women, with up to 30% of detected cancers unlikely to ever cause harm. Elaine, 74, lived independently and traveled often. After a routine mammogram, she underwent surgery and radiation for a tumor later described as low risk. The fatigue and weakness never fully went away. "I thought I was being responsible," she said. "I didn't know the trade-off." For women over 70, breast screening should be a personal choice, not a rule. If you feel well and have no changes, you may not need frequent tests. Paying attention to your body, such as new lumps, skin changes, or pain, is often enough. Gentle exercise, good nutrition, and strong muscles help the body stay resilient. Many older women choose fewer tests to avoid treatments that may cause fatigue or weakness. The smarter option is choosing what keeps you strong, steady, and comfortable. But the next checkup doesn't involve cancer at all, and still causes massive harm. If you know a spouse, friend, or family member over 60 who trusts every routine test without question, please consider sharing this video with them. One simple share could help someone you care about avoid unnecessary stress, procedures, or long-term harm. Blood sugar tests seem simple and safe. Many seniors are quickly labeled pre-diabetic. This often leads to overmedication, dizziness, falls, and dangerously low blood sugar levels. A 2018 study in JAMA found that tight blood sugar control in older adults increased hospitalizations and fall risk without reducing complications. Martha, 69, was prescribed medication after one borderline test. She soon experienced weakness and confusion and fell, fracturing her hip. "I was treating a number, not how I felt," she later said. Slight changes in blood sugar are common as we age. In many cases, they do not need strong medication. Simple habits help the most: regular meals, light movement, and enough water. Too much medicine can cause dizziness or falls. Many seniors feel better when numbers are kept safe, not perfect. Paying attention to energy, balance, and clear thinking matters more than chasing lab results. The goal is to stay steady on your feet and avoid sudden drops. And now, the most dangerous checkup of all, the one most seniors trust without question. If you're over 60 and want clear, science-backed guidance without fear or confusion, consider subscribing to Senior Health Support. This channel is here to help you ask better questions, avoid unnecessary risks, and protect your independence as you age. Colonoscopies are seen as the gold standard for prevention. Many seniors feel obligated to continue them indefinitely. But after 75, the risks often outweigh the benefits, especially sedation complications, bowel perforation, and infections. The American College of Physicians reports that routine colonoscopy after 75 rarely extends life, but significantly increases emergency complications. Frank, 78, went in just for routine screening. A complication during the procedure led to hospitalization and months of recovery. "I walked in healthy," he said, "and came out weaker." After 75, many seniors can avoid invasive colon tests. Simple at-home stool tests are often safer and easier. It is also important to notice real symptoms, ongoing stomach pain, blood in stool, or unusual tiredness, and report those right away. Eating fiber-rich foods, drinking enough water, and moving daily help digestion stay regular. Long procedures with sedation can be hard on aging bodies. For most seniors, the safer path is comfort, strength, and fewer medical disruptions. And that's why understanding when to stop is just as important as knowing when to start. Modern medicine is powerful, but not perfect. More testing does not always mean better health, especially after 60. Before any test, ask, what happens next if this is positive? What are the real risks versus benefits for someone my age? True longevity comes from movement, nourishing food, quality sleep, and awareness, not endless procedures. Before you go, I'd really like to hear from you. Have you ever been advised to take a test or checkup that didn't feel right or caused more harm than help? Share your experience in the comments. Your story may help another senior make a safer, more informed decision. Now that you know some common checkups can quietly weaken your health instead of protecting it, the next step is learning how seniors around the world stay strong without risky procedures. In my next video, Over 60, Japanese seniors use these moves to stay strong. I show you the simple daily movements older adults in Japan use to maintain balance, leg strength, and independence well into their 70s and 80s, without gyms or strain. If your goal is to stay steady on your feet, protect your joints, and feel stronger every year after 60, that video will show you exactly how to start.